Welcome to Mana TV and TV5. Today's our topic is how to prevent obesity. So we have many of our guests who are doctors, are part of the Aapi. In the last episode, we saw what Aapi does. Now we are going to see live how they are really going to help people from Aapi. We have almost 4 doctors today to really give us more insight on how can we prevent obesity. As you know, obesity is one of the major problems in the USA, and especially in this pandemic, we all need to be very much careful what we are eating, what work we are doing, and are there any exercises? How can we keep ourselves healthy? That's the main thing we have to focus. So today, again, welcome to Insight with Praveen Puram. Our topic today will be smart tips and ways to prevent obesity and complications by our Aapi doctors. Welcome everyone, doctors. How are you all?
Thank you.
You're doing good.
Good. Thank you. I would like to introduce all of our guests. First, I will go with Dr. Uma Koduri Garu, who is the Aapi chair for the obesity community. I would let her speak about this particular obesity and also tell about herself.
Okay, namaste. I'm Dr. Uma Koduri. I'm originally from Hyderabad, India. I studied in Rosary Convent and then Osmania Medical College, then came here to States and did my residency in internal medicine at Wayne State University in Michigan. After that, I've been working as an internist for the past more than 25 years. And since 2010, I've been very active in Aapi. And at present, I'm the chair of the obesity committee. Thank you.
Thank you, Dr. Uma. Thank you for your time tonight. I would like to introduce Dr. Uma Janalagadda, who is also the First Lady for Aapi, and I would like to introduce herself.
Thank you, Praveen. I'm Uma Janalagadda. I'm a family physician. I came from Guntur, Andhra Pradesh, and I did my medical school in Andhra Medical College. Did my family practice residency in Pittsburgh, and now I settled in Georgia for the past 20 years. And I'm big in obesity awareness campaign. I'm a current co-chair. Thank you.
Thank you, Dr. Uma. Thank you so much for your time this evening. And I would like to introduce Dr. Padmaja Adusumeli to tell about herself.
Hi, Praveen, and hi, audience. I am Padmaja Adusumeli. I am from Guntur in India, Guntur Medical College graduate. I came to US in 1993, did my residency in University of Kansas, now practicing as a geriatrician and at a VA medical center. And I'm the one of the co-chairs for obesity committee with the Aapi.
Thank you, Dr. Padmaja Garu. I would like to introduce Dr. Pooja. Pooja, over to you.
Thank you so much, Praveen. My name is Pooja Kinkabwala. I was born and raised in Chicago, Illinois. My family is originally from Ahmedabad, India. And I went to medical school at the Lake Erie College of Osteopathic Medicine, did my residency in New Jersey through the Hackensack system. And I recently completed my fellowship in endocrinology in Miami, Florida, where I'm currently practicing as an endocrinologist. I've been with Aapi for the past 5 years on their medical student resident fellow leadership committee and was past president of that section and currently co-chair of the obesity awareness committee.
Wow, awesome. Thank you, Dr. Pooja, and welcome to the show. And I'm grateful to have you all on this show in spite of your busy schedules today. So let's get started. I know that viewers are very much interested to know what are the tips and how to prevent the obesity. Let's get started with our chair, Dr. Uma Koduri garu. So why did you choose this obesity program during this pandemic on the awareness program?
Around the time I became active in Aapi, I was the founding president of the Aapi Tulsa chapter where I live in Oklahoma. And at that time, it was around that time that obesity has become a global epidemic. And then also obesity has been officially recognized as a disease, by the American Medical Association in 2013, June in Chicago. And obesity, it can lead to like diabetes, hypertension, heart disease, strokes, and even some cancers. Actually, it can affect almost every organ in the body. Also, during this COVID time, we need to know that obesity by itself is a risk factor, especially in younger population. And not only that, the World Health Organization, it has recognized that prevention is the most feasible option we have to curb this obesity epidemic. And then, so we need to learn to make the healthy choice the easy choice. In other words, we have to educate the community, everybody, how to be healthy in an easy way. So that was the reason we chose the obesity as our main campaign through our.
Awesome. I think this is a very important and initiative. I would say we need to take precautions rather than caring after the attack of obesity. So, what do you think in our Indian origin? Do you think obesity is a problem today, or which part of the countries you see more?
It is especially in the developed countries and also the developing. Especially developed countries like USA, it's like rampant. More than like 2/3 of the population come under the category of obese. Obese is like more than a body mass index of more than 30. We call it as obesity. In India, now it is increasing. But in India, we have like dual problems. We have obesity and we also have undernutrition. So.
Okay. So my next question would be to Dr. Pooja. Dr. Pooja, what are the major complications associated with this obesity?
So Dr. Koduri touched on a few of them, mainly anything within the metabolic realm, insulin resistance leading to diabetes, high blood pressure, high cholesterol. Along with that goes with increased risk of heart disease. And with that comes heart attacks, strokes, also can lead to amputations of the toes, the fingers. And a lot of times things that we don't take into account is the increase in abdominal fat can also lead to increase in the fat on our organs, leading to fatty kidney disease, fatty liver disease, and also affects our respiratory status and can cause sleep apnea, which in turn affects all of the other metabolic conditions.
Wow. So how do I recognize in the initial stages to general tendency, no one checks your, weight and everything. Mm-hmm. Usually, if you see in the Indian population who are in America, they definitely go for the physicals. But how about in India? People do not see their weight. How do they recognize this?
I think the biggest things to look for are any symptoms. If you're noticing any increased fatigue, you aren't able to go about your daily activities like you used to without taking a break. If you notice that you're feeling more tired than usual, even after you've had a full night's sleep. If you've noticed that maybe if you cut yourself, you're not healing as quickly. More headaches, change in vision, urinating more frequently. Those are all symptoms of things that are associated with metabolic syndrome that would lead someone to go to a doctor to get checked out.
Wow, that's a good input, Dr. Pooja. I should be careful because we always been in front of the computers.
Exactly.
So definitely I need to really check about it. Thank you so much. So let's get to another question, Dr. Padmaja Garu. What is a balanced diet in your view? What is a balanced diet which can avoid obesity?
Sure. I think before we get into the balanced diet, I would like to give a little bit more details about obesity and the complications. To know those, we have to know what are the ranges of the weight. What is the difference between overweight? Probably a lot of people may not know what is obesity meaning and its complications. And I just want to take a 1 minute explaining overweight and obesity. As you mentioned, a lot of times we know that we grow up to certain lengthwise till we become taller. After that, we start getting rounder or heavier. That's when we start noticing I'm getting a little bit heavier, but we don't pay attention to that. Most of the time we assume, my family is a little bit overweight. I could be a little bit overweight. And later on, the weight gain starts happening more often. And people starts having symptoms like Dr. Kinkapwala mentioned. They're having headaches, they're having more fatigue, they're having increased urination and these. And then they probably go to the doctor and they figured out that they do have a disease or they have an overweight problem or they might be starting a diabetes. And they do get every disease starting, the doctors usually recommend 6 months of lifestyle changes. Lifestyle changes is when it starts with the diet and exercise. I will talk about how to lose the weight by balanced diet, and Dr. Uma Jonal Gadda, she will talk about exercise, how to lose that extra weight.
Awesome.
The reason, thank you. The reason why a balanced diet is, we all agree, food is very important to us. It keeps us alive. It helps us, celebrate good times. It helps us cope with the negative emotions, something going wrong in our families, work life, personal lives. It's also, very important in our lives. Every time we go to different places, different vacations or religious activities, we gather around food. Food is such important. And if we don't use the food in a right way, it can cause problems. So we have to make the balance out, the joy out of food, as well as the help coming from the food as a part of balance. So that's how the balanced diet comes about. The balanced diet has 4 components. They are, we all eat them every day. Part of it is carbohydrates that in grains and chapati, roti, aloo, pop. This is the new thing. It's happening nowadays. We are drinking a lot of colas. And we also, another component of balanced diet is vegetables and fruits. And then third part is the protein. Fourth one is fat. All these components make it as a balanced diet when they are taken in the right proportion, right quantity. That's the key word, right proportion. We cannot have a lot of grains and have a little bit of fat and no protein. It doesn't become a balanced diet. So I will explain a little bit more about balanced diet over the next few minutes.
Wow. I think Dr. Padmaja, you have really touched upon the balanced diet. I am blessed to hear all these things, but I was destined to have this meeting with you all. Before that, I realized myself, if you see myself, I'm fit now. Do you know that I have reduced almost 25 lbs in 38 days? Wow. So now I understood how the body really digests the food and what kind of food we are eating, how much, there is no limit, right? So now I totally, what I'm doing, what you guys are saying, now I can relate why it is important. Every one of us neglect this, but I have experience. From my experience, I would say the balanced diet will definitely help. Thank you so much. So Dr. Umagaru, definitely from apart from the balanced diet and exercise, our activities are very important, especially to the guys who are sitting in front of the computers all day long. And during this pandemic, even kids, they don't have a choice. They have to be virtual. They have to be in front of the computers. So what are the activities really keep this balance along with the food?
First, I will touch upon why physical activity is important in relation to the obesity. Physical activity increases the total energy expenditure, okay? That keeps the people in balance or even lose weight, provided they don't eat more extra calories what they burn. That's number one. Number two, exercise decrease the fat around the waist and total fat content in the body, so that in turn decrease abdominal obesity. Number three, muscle strengthening, push-ups, those makes the energy increase in the body, that which can burn even while you're sitting in a day and making it easier to control body weight. Number four, physical activity also decreases the depression, anxiety, and it boosts the mood. It makes the people to stick to the exercise regimen and keep it longer. So these are the 4 ways that helps the physical activity in tackling the obesity. And during this pandemic, you have a lot of ways, you can do with social distancing, like go outside, go jog, ride a bike, and these provided wear a face cloth, where you are, around the people. And also one thing keep in mind, face cloth is not, in place of, distancing, you need to keep also distance. And, go for a hike. If you are near a state or, whatever the park is open nearby, go for a hike, get a fresh air. You enjoy the nature and get the fresh perspectives. And other activity like golf, swimming, these are good sports at present. Water is minimal risk of transmission of this virus. And also online classes, there are a lot more increased now. Virtual Zumba, yoga, and Pilates. You need to try to connect with the people online, make a schedule, and it will work out.
Thanks.
Thank you. Can't hear you, Praveen.
Oh.
We can't hear you, Praveen.
Thank you. Sorry, I was talking on mute. So Dr. Uma, you have rightly said about the activities. So the viewers would be definitely interested to know how much time we need to spend on these activities on a daily basis.
In order for you to maintain the weight, people used to say 2.5 hours a week is enough, but it's not. You need to have 1 hour of moderate to vigorous aerobic activity in order for you to lose weight. What is the moderate? You had to jog 12 miles for 1 week for a moderate activity. If it is a high intensity, 20 miles of jogging for a week in order to lose weight, provided you have a meal plan, low calorie meal plan, along with this kind of exercise in order to lose weight. So the two go hand in hand.
Thank you. Thank you. Let's come to Dr. Uma Koduri. So I see everyone has a yellow t-shirts, yellow backgrounds, yellow. I would definitely ask the significance. What is the significance of yellow? And I know before 2012, you have started your campaigning. What made you to do this? Is it a part of the giveaway to the community? Or
yes.
What made you to do this?
Yeah. So, all right. So I don't know where to start. Let me start right from the beginning. We started this campaign and we call it No Obesity Revolution. You put an N in front of O. So it's No Obesity Revolution. We started this on December 12th of 2012. So that is 12-12-12. And just to make it more exciting, we did the ribbon cutting, the inauguration at exactly 12 seconds past 12 minutes past 12 noon on 12/12/12.
Wow.
So,
What a
and the
coincidence.
mayor of our city, he inaugurated it, and we had invited a lot of the health department directors, the hospitals, a lot of people. So that's how we started. And then initially what we did is we started going to schools to educate the children, because at that time in 2013, Michelle Obama, she was into this childhood obesity.
Yes.
So, and then when we wanted to do the first event, we thought of giving T-shirts to the children. And then the next question is, what color? So at that time, the school principal and myself, we sat down, we sort of did research on colors. And then we chose this sunshine yellow. It's a pretty yellow for obesity awareness. We did research and found out that nobody is using any particular color for obesity. Like heart disease, you use red for heart disease awareness. And then you use the color pink for breast cancer awareness. So that's how we started, the yellow color for obesity awareness. The yellow color, it stands for energy, motivation, hope, optimism, joy, and happiness. All the nice things, joy and happiness. And then, so since then, whatever events we have been doing anywhere, we always do it with a yellow theme. Like we use yellow caps, yellow shirts, yellow ribbons, like yellow background. You see that yellow out, fight obesity. Banners in most of our events.
That's really
so
incredible.
Whenever anybody sees the color yellow, I want them to think about health, obesity, and how to tackle it.
Wow. Well, I didn't know really this is yellow means energy, hope.
Yeah.
That's a new thing I learned from this.
Yes.
From you today.
Joy and happiness. So ultimately everybody wants to be happy, and yellow stands for that, joy and happiness.
So Dr. Uma Koduri garu, you have started this momentum, right, on the obesity campaigning.
Mm-hmm.
Do you have any goal in a year? I need to motivate this many people. I need to do, most of my patients need to come out of this. What do you do on those grounds?
Our goal is to educate everybody in the whole world. That's why you see that world map on the logo. It's on my T-shirt. It's on this. It's behind, some of the doctors, the banner. So that is our goal. So to do that, what we have been doing is wherever possible, it could be at meetings, at conventions, in schools, medical centers, veteran centers, we have been doing these events. Aapi, actually, they set aside a lot of money for me and my team since 2013 to do it in schools in USA. And we have done 100, actually more than 100 school events in USA across more than 15 major states. So we have done that many. And then in India, in Hyderabad and the surrounding suburbs, we did, as of now, 12 schools in Hyderabad. And then our goal is to do it in at least 100 schools in India, and then spread it to other schools, other countries. So that's our goal. And then also we do it at almost like even in the Aapi, we have a yearly annual convention. We have been doing these Aapi walks, Aapi obesity walks for the past 2-3 years. And then as of 2019, that is last year, we covered all the 7 continents.
Wow.
Including Antarctica. So even in Antarctica, they did an obesity walk with yellow shirts, yellow caps, and it was. So basically our goal is every person, they can educate first themselves, educate their family members, neighbors, at work, your colleagues, and you teach your children, and the children can even, talk to their school friends and basically teach them. We are going to make it very simple how to lose weight, simple, like diet, simple exercises that you can do to overcome this. And basically that's what, and also we have been doing for the veterans. They are our nation's heroes, I and Dr. Padmaja, we actually work in the veteran medical centers. And we have done so far 12 events, major events for the veterans in the veteran medical centers, and also other centers like veterans of foreign wars, all those.
Wow. What an incredible thought, Dr. Uma. I wish that you expand to all the 100 schools in our motherland, as well as in US. I know that you have covered 15 states. I wish you would do all the 50 states and then, make it a change.
That was our goal, but it's difficult, it's difficult because we don't have Aapi chapters in all the 50 states. We don't have it in some of the places let's say Hawaii or Alaska and all those. So 50 states is not practical, but our goal is to do it, in as many states as possible.
We wish you, Dr. Uma. So let's come to Dr. Pooja. So Dr. Pooja, my question to you is, what are the considerations for the South Asian population, especially on these obesity? Do you see more, or what are the considerations we can suggest?
Sure, that's a great question. So just the fact that we are South Asian puts us at increased risk of obesity and obesity-related illnesses such as diabetes, high blood pressure, heart disease, and high cholesterol. Heart disease runs rampant in the South Asian population. Another thing that we need to take into special consideration is the fact that Asians in general tend to hold a lot more fat in our abdomen on top of our organs. So any increase in abdominal fat dramatically increases the risk of developing any of these obesity-related illnesses. In fact, the obesity and the overweight markers for BMI, which for those of the viewers that don't know, is essentially a ratio for our height to weight, is decreased for any Asian population. So whereas in a normal population, overweight would be a BMI of 25, in Asians it's 23. And in a normal population where a BMI would be 30 for obesity, in South Asians it's 28. So we really have to make sure that we're managing our weight, we're managing our diets, especially we have frequent celebrations throughout the year, and a lot of those celebrations involve foods that are very high in fat, very high in sugar. So making sure we kind of plan this in advance. And look into our family histories. Is there a history of heart disease? Is there a history of diabetes in our family? And making sure that we're taking extra steps to make sure we're checking with our doctors regularly.
So are there any changes because of the COVID situations today? Do you have any guidelines?
There are, mainly having to do with the increased risk of developing COVID-related complications due to obesity. The fact that there is increased weight in our abdomen increases the risk of having shortness of breath. Also having high blood pressure, diabetes increases those risks of complications as it is. But another thing that we're now seeing is that in anyone that does have any history of heart disease or any history of diabetes prior to a diagnosis with COVID, or even if they were borderline prior to a diagnosis with COVID, even if they were asymptomatic, we're seeing a worsening in these symptoms. So again, something to make sure that you're checking regularly. If you were pre-diabetic, if you had a borderline sugar, the simple fact that you have this virus could all of a sudden make you diabetic and need more medication and need to be watching your diet more closely.
Awesome. I think in those grounds, I have last question before I move on to the other guest. So if you see any of the popular apps, right, if I get onto the weight scale, it gives me 12 related or at least 17 related indexes, right? If you talk about BMI, muscle mass index, or skeletal mass, body water, and fat free. So what are the things you need to consider? As an individual, I'm not really knowledgeable and I will be not monitoring. So to the audience, what would be your suggestion? What are the key indicators you need to look and how they are interrelated?
So I would say the key ones to look for, especially on those scales that give you these multiple parameters, are going to be your BMI, your body fat percentage, and your muscle mass percentage. The higher your muscle mass is, we know that increases your metabolism, so you're more likely to burn more weight as it is. And also that relating to your body fat index. So those were the three that I would look for particularly.
Awesome. So definitely we will come to more on what are the levels based on the height and all the stuff. That would be really interesting factor. In the interest of time, let's move on to Dr. Padmaja Garu. So today, if you see, there are a lot of fasting mechanism, right? Some will say fast in a week. Some will say 2 times a week. Some will say intermittent fasting. So people are confused today, which diet to follow, what nutrition to follow, what are the different kinds of fasting you have to do. Can you please elaborate to our viewers, what would be an ideal situation?
That's actually very interesting because I hear that quite a bit from patients as well as my friends that are non-medical friends that ask me that question because they are hearing all these. Let me give you the three pointers about weight loss by diet, right? Intermittent fasting, they are doing it to lose weight. To lose 1 pound of weight, either they need to eat 3,500 calories worth of food, or they need to burn 3,500 calories.
Oh, wow.
So by exercise. So the studies did show if they did it with both ways, a little bit cut down in their diet or their calories and spend the calories by exercise, then they are able to lose a lot of weight and keep it off. Losing weight quickly makes our body go into these protective mechanisms that will make us retain the weight, not able to lose it. Because once the body recognizes we are starving it, it has its innate mechanisms to prevent the weight loss by diet alone. And also what happens is when we are starting these intermittent fasting, first 2 to 3 days, our body burns calories from the glucose that is stored in the liver. Our brain needs glucose. That's the only ingredient that it can use to stay alive. Rest of the body is able to cope with loss of calories or lack of calories for a while. So first 2-3 days, all the calories are coming from the liver. That's glucose is burned from the liver. So from the day 3, day 4 onwards, if there is no food available, enough calories coming in, the body starts breaking down the muscle. Muscle, as you mentioned, or as Dr. Kinkabwala and Dr. Jonal Gadda mentioned, muscle mass is very important. It protects us. It keeps us safe from other organisms entry, as well as from trauma, daily wear and tear on the body. So and also they increase the metabolic rate, meaning the number of calories it burns. Just by sitting like here, I need so many calories to breathe, to make my heart pump blood all over, and that blood needs to come back. My kidneys need to work, my liver needs to work. They all need calories. But when we lose muscle mass, the BMR goes down. That's when it's a problem. After at least a week of the BMR going down and muscle mass almost breaking down, that's when the body goes into the fat burning. So that's by that time, your body is recognizing, oh, it's a problem. Nobody is feeding me right. I need the vitamins. I need the antioxidants. I need the flavonoids. They are not feeding me. They are eating a few many calories that my brain needs. I'm already burnt up. I don't know. It goes into this emergency mechanism. that's when it starts having problems, causing a lot of issues like dehydration. First of all, when we don't eat enough food, our body cannot handle that much of water, and we actually lose a lot of water. So we go into the dehydration mode. And also some of the patients actually have low blood sugars, or their blood pressure starts going down, and they have falls, they break bones. And also the main problem is whenever we don't eat certain right foods, our electrolytes in our body goes havoc, meaning our sodium levels either go up or down, or potassium levels. That causes a lot of problems with the heart rhythms and irregular heart rhythms that could happen. And these are the things, and happen right within the first few days to weeks. Over the time, when we are not eating a balanced diet that has all these carbohydrates and vegetables, fruits, protein, that's when the bone marrow gets insulted, and it stops making its blood cells, and it also stops making hormones that we need to keep the biological rhythms. Like in women, they stop having periods. Men get into this fatigue or low sex drive, and with the loss of all these things, their body senses something is not normal. They start having irritability, depression, anxiety, and like that, all the one after the other, the system starts affecting. That's why the intermittent fasting is helpful when they are normal, healthy adults. It may help just for a short while. I would not recommend it for long term. If you want to do it for long term, want to lose a lot of weight, I would highly recommend to talk to the doctor, gather the details, and do it under their supervision. They usually get you to see a dietitian. The dietitian will follow, make sure they check your hormonal levels, they check your vitamin levels, and make sure your blood sugars, everything is doing well, and they help you do that. So that's what my position is regarding the intermittent fasting.
Wow. That's so much information. Now I thought that is like a financial accountability. Right? It's very interesting. You told a lot of facts about how the body really functions and what it needs. So I get this question all the time. To my knowledge, I have never checked my vitamin levels. And so everyone else too, because they are very busy in their own world. So yes. What do you suggest? How many vitamins body needs, and what is a quick check on the accountability?
Okay. So we don't have to check all the vitamins, but at least there are some of the basic blood tests your doctor recommends, complete blood count or regular chemical profile. Blood count tells us anemia. Anemia, by looking at that anemia or the type of red cells we have, how our hemoglobin is, with that we can recognize what vitamin deficiency it could be. Either it's folate coming from the vegetable deficiency, or B12 that comes from legumes or beans or meat, dairy products. If we are not eating, then vitamin B12 level goes down. It causes anemia. And also vitamin D, we get it from our skin. If we are not eating enough protein and enough fat or cholesterol causing foods, then our body cannot make the vitamin D. Vitamin D tells your body to absorb calcium. See, that's how each one causes another. There is thousands and thousands of mini chemical reactions are happening depending on the previous step. If one step is not going the right way, the next step doesn't go that way. The next step gets affected. The next step says, oh, I cannot function this way. I need to find a bypass. And it bypasses and causes more problems in the long run. So at this point, to make it easy answer, to give a quick answer for you, the vitamin levels we can check all the vitamin levels, A, B, C, D, E, F, K. But the important one for a normal person, depending on their age, I would recommend getting vitamin D level, because vitamin D level having low level also increases the bone loss, fractures, as well as now with the COVID, in the COVID era, They are detecting higher levels of COVID infection with the vitamin D deficient patient. We can get folate level checked, vitamin B12 levels checked, and a lot of other vitamins, we can get them checked. But if we are eating balanced diet, you don't have to check any levels. You won't have any symptoms, you won't have any anemias, you won't have any problems, and you don't need to. A lot of us in India, we never got them checked until we got a certain age, unless we have a symptom.
Yeah, so exactly. I feel that some of the food habits are really excellent in India, though they are not, everything is not checked, but we are intact. With our ingredients, what we put in our food, it's all balanced. Awesome.
It's good. It was good. I would say the dietary system in India was good, not anymore. Especially with the latest industrial revolution and our sedentary lifestyles, the type of diet we eat in India is no longer relevant to the lifestyle we are living at this time, either in India or in US. It's totally different and we need to change it. That's why my balanced diet, I need to talk about balanced diet in detail.
Awesome. Thank you. Thank you so much for the information. Now let's come to Dr. Uma Jonalagagar. What do you need to do not to gain weight? Is there any? Tell me 5 things in my daily routine that I should not gain weight.
Exercise. It is a much debate how much activity you need to prevent you from weight gain. As I said, activity, you need to have at least 1 hour. 1 hour of activity, moderate exercise. Many of the women I see slow walking. It's a low intensity. It has nothing on the body. Maybe it will help you maintain with the chronic conditions in stable condition, but it won't make you lose weight and not able to, keep your weight. So you need to have a brisk walking, bicycling, those kind of activities. And increased aerobic activity, as I said, Zumba, things like that, whatever raises your heart, jogging, at times swimming, those kind of activities need to be involved. But just walking doesn't make you lose weight. And as I said, 1 hour minimum, 5 times a week. And children, 1 hour a day. At least, activity outside, moderate to, more, whatever higher level of activity. They need to play sport. I want to touch a little bit about the gadgets, Praveen. You said about the children. I realized that 1 in 3 children, when the toddler age, they know how to use an iPhone before even they can speak.
Exactly. You're right.
And do you know these gadgets, increases their hand skills, cognitive and competitive skills, but it makes the children attention deficit hyperactive disorder. They are not able to pay attention. They're restless. They get anxiety, depression, all these things. So children should stay away from the gadgets not more than 1 hour a day. Parents has to have a control, keep 1 hour a day, and make them play outside activities, at least 1 hour a day. And also parents shouldn't leave the gadgets as their babysitters for children.
Yeah.
And let the children sleep at least 10 hours a day.
Awesome.
Those are the important things to touch up for children.
I think
for adults, as I said, 1 hour a day, moderate to, severe aerobic activity, whatever, and 5 times a week, along with a low-calorie meal plan. That
awesome.
Keeps you stable, and maybe, if you work more, maybe you can lose weight.
I think you have touched the right things in this COVID. Just before this show, I had a discussion with my wife too on this, how the kids, you don't concentrate on them. They are just enjoying the gadgets. It is very new. They wanted to explore everything, what their teachers have said. So I think we need to really, not only me, all of the parents who are watching this session, definitely they need to understand what are the controls and measures we need to take. So thank you again, Uma Garu. Let's come to the last question to Dr. Pooja, and then I will hand it over to Uma Koduri Garu to give her final comments on this awareness program, and we will conclude the session. So Dr. Pooja, what are the lab results? Yeah, right? Every year we do the physical, right? So what do you suggest people to look upon? See, I have traveled from one doctor to a different doctor when I moved from one state to other state. So every doctor has a different style of their physicals. You agree or not?
I do, yes.
I get confused, like, what do I need to? Is it, first of all, my mind gets, is it covered in insurance or not? Am I really want this or not? So what do you suggest as a part of the physical? What are the important labs, tests we need to do?
So first I want to touch upon what we call vital signs. So those are your height, weight, blood pressure that is going to be taken at the beginning of the visit. Mm-hmm. For height and weight, you want to make sure that overall your BMI is going to be right around, especially for South Asians, we want to aim right around 23 or lower. Between like 18 and 23 is kind of that sweet spot. Between 23, 25, you're in the overweight zone. It's still okay, but we don't want to get close to that 28 level. As far as your blood pressure, you want to aim for, 120 over 80 is the ideal, but you don't want to be above 130 over 80. And then as far as labs, the main things that you're going to be checking, like Dr. Adamsley was mentioning earlier, CBC and the metabolic panel. CBC, you want to look at hemoglobin levels. Your doctor will tell you if it's within range or not, but ideally you kind of want that in between like 11 to 14, 15. On your metabolic panel, most of the times you're going to go get your blood drawn without eating. You want your glucose to be below 100. You want to make sure that your sodium, your potassium levels are good there. And as far as the other labs that are most likely going to be drawn, cholesterol is going to be a big one. The one thing that's really important to look at, and as an endocrinologist, the two levels that I look at a lot are the LDL, which is the bad cholesterol, and the triglyceride levels. Both of those affect the cholesterol buildup in your arteries. For triglyceride levels, you want that to be below 150. And the LDL, the bad cholesterol, for someone that's healthy, has no issues, you want that to be below 100. If you have any issues like diabetes, heart disease, below 70.
Oh my God, I need to watch those, LDL and triglyceride, those are the culprits I have to watch on. Thank you so much for this information. And definitely we all will try to watch upon those. And I think this session is really useful to all of them to understand from the habits, food habits, exercise habits, what are the lab checks, and how we need to keep up with our weight. So I think these are the really great lessons I would take away, and also the viewers would take away. And in the interest of time, so I would let Dr. Uma Koduri Garu to give the final conclusion about this obesity program. What are the next steps and how you are going to achieve the goals what you have set for. And thanks Aapi for this wonderful program too. So after that, then I will let anyone wants to conclude. Then that's the end of the show. Please, over to you, Uma Koduri.
Praveen, I just wanted to explain the logo, which is all over. Okay. The world map. Okay, there's a walking track around the world map. Okay, you see a man, a woman, and a child. A man, woman, and a child. What it means is it's a family effort to fight this obesity. Okay, the father, mother, child, everybody should do it together. And then you see that they're all walking. The pictures. It's just to show that brisk walking is one of the easiest way to burn calories. But as Dr. Junalgada said, the others are very good, like, Zumba, dance, anything, skipping, things like that. But remember, even housework, is also you burn calories. And then the rainbow colors, they indicate that you have to eat a variety, colorful fruits and vegetables, because they are loaded with vitamins, minerals, nutrients, fiber. So that's what it stands for. And then the very center is yellow. That's because we chose the color yellow. And then it's a world map, because our goal is to spread this education about obesity, awareness, and complications, how to fight it and all over the world. That is our goal. And to do that, we have been trying a lot of things, like going to schools and all that. But now, because of COVID, we thought we cannot do any group activities, right? So the new thing which we just started, actually August 27th of 2020 in India, one of our team members wear yellow on Thursdays, okay, for workplace wellness. So workplace wellness, yellow on Thursdays, that's our new campaign, which anybody can do. And then how did we get this idea? For the last many years, the American Heart Association, they wear red on the first Friday in February. The first Friday in February, we wear red for heart disease awareness. So we are going to start the first Thursday in January, which is going to be January 7th, this 2021. At workplace, everybody wear yellow, and then you educate your colleagues, and they can educate their family members, neighbors, and that's how you can spread it all over the world easily during this COVID time. So that's our new idea.
Thank you. Thank you.
So we need your help. We need the media. We want to do webinars. Because nowadays that's how we can reach the communities, everybody. Because
I think that's awesome, Dr. Uma Garu. As I said to Dr. Uma Jonalagadda last time, I said I'm very committed, and I'm more than happy to promote, help, and whatnot, whatever you need. So even the viewers, I would say, if you have any questions, you can reach out to me or reach out to anyone in Aapi if you have any questions. We are more than happy to connect and help people for the well-being. And as Dr. Uma said, that try to wear yellow clothes
on Thursdays,
to be
at
work well-being, right?
Yeah.
So that's the way we show, that's the spirit we need to raise, and we need to keep healthy. Dr. Uma, I would say, tell me.
One last thing. To make it very official, we were successful in getting official proclamations from the governor of Oklahoma. I live in Tulsa, Oklahoma. In 2013, I was able to get an official proclamation by the governor to wear yellow for obesity awareness. And then similarly, many mayors, we got it from many cities. So that way, even the government will be involved. They will also hopefully get involved. And then right now, Dr. Jonalagadda, the president of Aapi, he's trying to get it from the governor of Georgia. That's where they live. Uma Jonalagadda.
Let me know, Dr. Uma Garu, if you need any help, I can connect to the right people. And our governor is definitely a very, very, very nice gentleman, and he supports in all the initiatives.
Okay, sure. Right. We'll reach out to you. Thank you so much.
Thank you.
Sure. Any final comments? Anyone want to? Yeah, please go ahead.
I can give a few more pointers if you viewers like to do. I would like them to research about myhealthyplate.gov. It's an American website. They can look at it, and it gives detail. And a few more pointers that helps us in the daily life is drinking 1 glass of milk before they eat meals. That would be helpful because it fills up the stomach. The second pointer I would say is eating in a 9-inch plate. Whatever you are trying to eat a meal, just put it in the plate, just like in that Healthy Plate organization. And use raw vegetables. Raw vegetables gives you all the nutrients without losing the vitamins in it. And one more is eating with a fork or spoon. Rather than eating with the hand, taking a big lumps of food, eating with a fork or spoon, it makes you eat small bites and chew them well. Pay paying attention to taste, texture, and smell of the food actually gives you more satisfaction. If we are eating in a hurry, we eat lots of food, but we may not enjoy it, and we gather more calories. And one more point, I have a lot of points. If you are willing,
I know.
if you want to, I can give you, but I wish that you have enough time. One more big point is once we start eating, and your body takes at least 20 minutes time to recognize, I think I had enough food, I need to stop. It takes 20 minutes of time for the stomach to recognize we had enough, get off of the table. So the way we can use that is to start chewing vegetables first. So it takes a lot of time to eat the salad, then eat the protein, which we need really, then end up with the carbohydrates or grains or starches. That way you won't eat that much and your calorie intake would be low. And having a healthy snack ready when you get hungry is another point.
Thank you.
Yeah.
I think that's a great input on this obesity. And viewers, please don't take it light. I think we all need to work for ourselves, not for doctors or anyone else. And believe me, if you are the average weight and to your mapping to your height and weight, everything is okay. You feel a lot of energy. You get a lot of energy and you feel energetic. And believe me, we do our car servicing on time, but we don't take care of ourselves on time. So please don't be materialistic. Please, health is wealth. And I would like everyone to follow all the tips given by our doctors. And thank you for all of them for, dedicating their time this evening, apart from their hectic work and seeing the patients. And, I would really, again, thanks from the bottom of my heart to give your time for all of the viewers and these benefits. And we will meet again more with different varieties of preventions to keep us healthy. And Aapi is there to support all of us, and we will get more visibility on different diseases, how to prevent them. So that's it. Keep watching this Insight with Praveen Puram, and you can see on Mana TV and TV5 too. And let us know your thoughts and feedback, and we can get more this kind of interviews. Thank you all, doctors. Have a good night and
Thank you.
Stay safe.
Thank you. Good night.
Thank you.
Good night.